Hello, my fellow medical and health science library professionals. My name is Kristen, and I will be talking to you today about the information behaviors of caregivers of people with dementia, challenges this user group faces, and ways we can improve their information seeking process. After conducting a significant amount of research, many professionals in the field have found that the needs of caregivers of people with dementia have not been fulfilled when it comes to taking care of a loved one with the disease. Family caregivers often face this task with little to no knowledge of the disease, which leads to stress and confusion on top of the emotional toll that comes with the diagnosis of a loved one. This topic became of interest to me because of my family's own experience when my grandmother was diagnosed with dementia in 2014. We went through various stages such as denial, confusion, fear, and grief as the disease progressed. We experienced both at-home care, a memory care facility, and hospital care until her death in 2022. Because of the information search process we went through, I chose to better understand the fluid barriers and enablers in the information behavior of caregivers of people with dementia. This poster presentation aims to identify challenges this user group faces, as well as to suggest multiple solutions to these challenges. The most prevalent challenges of caregivers of people with dementia are a lack of emotional support and a need for personalized information. Watching a loved one go through the stages of dementia leaves a caregiver, whether formal or informal, feeling frustrated, upset, or even helpless. Seeking out information on how to manage emotional distress of the caregiver has been found to be of significant need for this user group, but it's often not prioritized. The caregivers often place a higher importance on obtaining knowledge on how to care for the patient or family member, leaving their own needs unattended. These caregivers are left feeling alone and living a lower quality of life. Personalized information has also been identified as an important factor in this user group's information behavior. Caregivers claimed that information targeting their specific scenario helped them to make more meaningful connections. Factors such as severity of the disease, age demographic, familial relationships, and more can all have an impact on care plans and daily living needs. Improving the search process to meet both emotional and personal scenario needs can ease the stress and improve quality of life for both the caregiver and the patient. One of the most crucial needs of caregivers of people with dementia is having reliable and trustworthy information. Ensuring access to these sources can provide caregivers with general information on the disease, which can overall relieve stress and confusion. Providing this user group with the tools to find the information they need may look like the patient's doctor communicating this knowledge directly or informing the caregivers of resources online sourced from licensed medical practitioners. Oftentimes, the caregiver doesn't know what they need to know, which inhibits them from searching. With easy access to memory care information, the user can discover knowledge serendipitously, which can fuel further searching. Furthermore, when a patient is diagnosed, the intended caregiver should be given awareness of educational programs and trainings on the basic care and daily living procedures required for this disease. Also suggested are support groups designed for families of dementia patients funded by the government as a way to foster community and therapy resources. This can include cognitive behavioral therapy for depression, for example. Caregivers should have access to programs at local libraries or research hospitals to teach them how to conduct the information search process for their specific needs to equip them to know where and how to look for answers. In a world where medical advice directly from medical professionals takes time and knowing what to ask for, these tools can help to improve the emotional support needs of the user group. Personalization of information for caregivers can look like one-on-one meetings with healthcare professionals who factor in the nuances to each situation. Medical counselors are able to connect with patients and caregivers at a personal level without the use of confusing jargon that may leave the latter feeling even more lost. Medical counselors can be matched with caregivers based on their information literacy and willingness to accept new information, which is just as important as the information itself. Personalized information can consist of medical care, financial guidance, mental health advising, and more, all of which cannot be generalized to be effective. Access to these counselors could be made easily and readily available through memory care hospitals passed around within support groups or a multitude of other avenues. Information sharing is also suggested as a means of providing a more organized and standardized process of communication. Information sharing consists of individuals disseminating what they know through interactions with others in similar circumstances. Sharing firsthand knowledge allows caregivers in the dementia community to take that information and apply it to their situation with a more personal touch. This can be done through online or in-person support groups, for example. Overall, access needs to be improved for this user group to find the information they need and for it to be effective in their day-to-day life. Improving access boils down to the user group knowing that these resources exist and where to find them. Understanding the information behaviors of caregivers of people with dementia helps us find obtainable solutions to the information needs. Being aware of this user group's barriers and enablers that are subject to change, such as emotional support needs and the desire for personalized information, gives library professionals the insight to fulfill the information needs of others. Thank you for stopping at my poster and enjoy the rest of the virtual presentations.